All right. Again, hello, everyone. Thank you so much for taking the time to join me today. I really appreciate it. For those of you who have not met me before, my name is Sydney, and I am a wellness technician within the county's wellness program. My personal background is in fitness and health education and promotion. And a big part of what I do here at the county is helping employees feel more confident with their own health. So, whether that's through movement, preventive screenings, or everyday choices that support long-term well-being. That's kind of what my job is, and that's why I'm bringing today's presentation to you. Part of making choices about your health is being informed enough to be confident in the decisions that you're making. Because of what I do, I often run into employees that share their experiences with being overwhelmed by healthcare, the healthcare system, the whole nine of it. And that feeling of that being overwhelmed, it ends up leading to confusion or frustration, and that really tends to keep folks from taking action. So today's presentation is going to focus on health literacy, what it is, why it matters, examples and common terms that you can kind of relate with, and ultimately how you can take control of your health through advocacy and utilizing some of the resources available to you at the county. So first things first, starting off, health literacy isn't just about what you can read, like what you can actually physically read. That's not health literacy in its entirety. It's about comprehension. Do you understand, like truly understand what you're looking at, what you're reading, whether it's test results, medication? With that comprehension, are you confident? You understand it. Are you confident in it? Can you take decisions and make decisions with full confidence? And then are you ultimately able to make and take action? So we're going to focus on two types of health literacy, starting off with personal health literacy. This is the degree to which individuals, so you as an individual person, can find, understand, and use information and services to make health decisions for yourself, your family, maybe if you're a caretaker. So it may not just be you personally, but this speaks to your personal ability. It's focusing on you and your skills. Secondly, here, organizational health literacy. This shifts the responsibility onto the system. So in our instance, the county. This is our responsibility, ensuring that information, policies, programs, communications, making sure these types of things are easy to access, they're inclusive, and they're easily understood for everyone. We don't want things worded in a way that they are not accessible to most individuals. So that is the organization's responsibility. From my perspective and job as a wellness tech for the program here, that means thinking about how we relay health information. Is it clear? Is it accessible? Is a presentation I'm giving to you today, do you understand what I'm saying and does it make sense? An email that you get from communications that has wellness news on it, did we present it in a way that it makes sense to you pretty much? So, because it could make sense to us, but it may not make sense to the general public. So true health literacy, it's a shared responsibility between individuals learning how to manage their health and organizations being able to create environments that support and encourage that type of learning. So now that we understand what health literacy means, both personally and from an organizational standpoint, let's kind of talk about why it really matters. Because when health information isn't easy to find or understand, it can have a real impact on how we care for ourselves and our families. Additionally, it's important to remember that we all face challenges with health information sometimes. Factors like language barriers, education, culture, or even access to resources can make understanding health info pretty tricky and confusing sometimes, and that's totally normal. This is not a conversation to feel ashamed or embarrassed about by any means, because being aware of these challenges is the very first step in being able to take charge of your health and getting the support you need to make smart choices. So, health literacy, like we said, it is about feeling confident when it comes to your health, knowing how to ask questions, where to find reliable information, and how to make choices that work best for you. When health information feels overwhelming, hard to understand, it can really cause people to put off preventive care. So we're going to kind of go down this list on why all this information matters. So first, starting here, being put off to preventive care. Things like your annual checkups, screenings, vaccinations. Over time, missing these kind of smaller things that maybe we don't often think about, whether you do them or don't, it means small things might not get caught early. That's the whole part of preventive. One year, everything's good. You're fine and dandy. Going next year, oh, something's going on. But there's been a short amount of time between those two checkups, so you can address things with a little bit more urgency. Now, if we had our checkup maybe this year, but then we don't go to the doctor again in 5 or 6 years because we don't think we have to, we don't feel like we have to, and we put off feelings that we need to see a doctor, now you have an even longer span where who knows when something develops. We have less understanding of our health in those instances. Secondly, here, low health literacy is often linked to more emergency room visits and hospital stays because people may not recognize warning signs soon enough or may not know where to go for the right kind of care. We think emergency room, we think the urgent care clinics, we think just our regular doctor's visits. We may not know which place is necessary to go to depending on how we're feeling. Sometimes confusion about symptoms, insurance coverage, or appointment instructions can also lead to delays in getting help, which can make conditions worse or harder to treat. Kind of just talked about that with that decreased preventive care as well. And misunderstanding medical instructions like how to take medication or interpret test results can lead to mistakes or frustration, which no one wants when dealing with health concerns. If we're concerned about our health, things are already a little stressful. We don't need confusing directions and misunderstandings to occur to heighten that stress. We want everything to be very clear, may not be cut and dry, but we want information to be clear and understandable because we're already a little stressed out. And all of this can ultimately create anger or mistrust towards the healthcare system as a whole. And when people start to feel unheard, confused, we don't want to feel those things. That makes us feel a little weird about ourselves. So when people start to have those emotions, it is super easy to lose confidence in providers and even avoid care altogether. So some of these things, this is why improving health literacy matters, so that it can make you feel more in control, confident, and supported when it comes to your health and those for loved ones and anyone that you may take care of. So let's make this a little bit real. It's a whole lot of words, and they're all good words, but let's make this real with some examples. So how does this show up in day-to-day? Recognizing early symptoms and seeking care. So noticing changes in your body and acting early. Prompt care can prevent minor issues from becoming ultimate serious problems. Oftentimes, especially for busy working people, if things start to feel a little weird, you're like, oh, whatever, like I'll deal with it later. I don't have the PTO to deal with it right now. But it's hard when you continue to put off feeling that way. We don't know what's going on. So understanding, checking in with yourself, taking a second, being like, these are some symptoms of something that I may have come across or a condition that I have. Things may potentially be getting worse. I need to go seek care. I need to make that decision for myself, figure out life, and I need to go seek care. Understanding preventive screenings. It's just keeping track of recommended screenings and scheduling them on time. Like, do we know at what age we need to start getting colonoscopies, or how often we go between well woman pap smears and such? Do we know these things, and do we follow that guideline? Or again, does life get busy and crazy and you're like, I simply don't have the time? Maybe I know what is going on potentially, I just don't have the time. So being aware of things that apply to you, talking to your provider, asking questions about some of these services, and just having a clear understanding of when you need them. That second point there, going to quickly touch on that one, interpreting prescription labels and medications. I don't know if you've ever gotten a medication and it has some instructions on it and you're just like, all right, I will take this whenever I get to it. Maybe it's not that serious, or maybe you've accidentally missed dosages and you're not sure what that looks like, what that means, what you should do afterwards. being able to communicate with your care team and having kind of open and honest conversations with your providers about, I got this medication. I don't know exactly what this means for me. Can you explain it to me? A huge part of this presentation is going to learn how to be an advocate for yourself and that it's okay to ask questions because that is literally what your care team is there for. Ultimately, ideally, the healthcare system is there to help you at the end of the day. You just have to ask the questions. And they may not even be the right questions necessarily, but maybe we'll get there. But at least you're starting to engage in these conversations with healthcare providers. So by being active in your own care and by asking questions and clarifying instructions, you are absolutely allowed to do that. You don't just have to take the paper or the medication and go about your day if you're not sure what it is. Or maybe take a pause, take a second, read through it while you're there with your provider and be like, I don't really understand what this means. Let's talk about it real quick. Or a lot of providers have patient portals. Feel free to type them a little message. My doctor, she has her PA that sometimes messages me. Perfect. We have a care team. Everybody's working together. Don't be passive about your healthcare. You are an expert on your body. You are an expert with your health. Your provider can only help you if they somewhat know what you need. Again, it may not be the right question, but if you start inquiring, you may get there eventually. So like I said, you may not know exactly what's wrong, but when you start putting this information out there and you start informing your care team about what's going on, some of the first steps in getting down to what's happening. Being active in your health also comes with knowing what a couple of common biomarkers mean. Now, this is going to look kind of like your biometric screenings, which being in the wellness program, being part of HR benefits, make sure you get your biometric screenings done before November 30th of this year, please, if you are on the medical plan. But these are a couple of things that you may see because the biometric screening does test for these. Even if you're not on the medical plan and you just do regular blood work with your doctor, these are often things that pop up on some of that annual blood work. So a couple of these things, let's just go down them really quick. Blood pressure and cholesterol, I wanted to mention because some of our top conditions here at the county involve hypertension and hyperlipidemia, which tie with blood pressure and cholesterol. So blood pressure measures the force of blood against your artery walls. Normal is around 120/80. High blood pressure, hypertension, increases your risk of heart disease and stroke. Being able to track it regularly helps you spot changes early and take action. So same thing here. It's like when you go to your appointment this one year and then you go the next year and you see small changes, you see small increases in your blood pressure, you're like, oh, okay, something's happening here. Small changes are happening. We're starting to see a trend. Maybe we can start implementing lifestyle changes, diet, exercise, even medication. Let's start implementing changes now because you see this small trend because you go to your preventive care visits. Instead of we have our appointment here, we have another appointment in 5 years, and all of a sudden our blood pressure is through the roof, and the only way to control it is through medication and maybe some lifestyle habits. So it's just noticing small trends and being able to start to address them before even larger issues arise. Similar here with cholesterol. Cholesterol is a fat-like substance in your blood. High levels, which is what hyperlipidemia means, can increase your risk for heart disease and stroke. So again, knowing your numbers lets you make diet, exercise, and treatment decisions to protect your heart. So having a concept of some of these items and noticing small trends over time, or even noticing that first small trend where you see an increase in some of these numbers. Sometimes things are genetic and you can do everything you can to prevent them, but starting to see that trend, starting to see some of these changes can start to alert you, be like, okay, I need to take some action before we start getting a little serious. So, and those are conversations that you would have with your providers as well. Blood glucose, A1C. I know this one tends to be optional for our biometric screening, but it's always something good to keep your thumb on. Blood glucose measures sugar in your blood. A1C shows your average blood sugar for about over 2 to 3 months. High A1C levels can signal prediabetes or diabetes, which affect your overall energy, heart, overall health. Monitoring these numbers helps manage and prevent complications and decrease your risk at the end of the day. Lastly here, just a quick mention, BMI is a little outdated, but it does have some standardization associated with it. So BMI, body mass index, estimates body fat based on height and weight. And then waist circumference is when they whip out that little tape measure. They tell you to hold it at your belly button, and then they walk around you. Waist circumference measures abdominal fat. Excess body fat, especially around that waist area, that's why they take that measurement there, is linked to higher risk for heart disease, diabetes, and other chronic conditions. So all of these things, just knowing these numbers, and if we start to see a trend of some of these things increasing, again, you can begin to make lifestyle decisions based on that small trend before they develop into something greater later on, if they do. So with all that being said, how can you put all of this knowledge into action? There are simple, practical ways you can take charge of your health and make informed choices. First things first, again, here we are, get a biometric screening done. So screenings measure things like we just talked about, blood pressure, cholesterol, glucose, and knowing your numbers is the first step to understanding your health and spotting changes early. Secondly here, keeping track of your health info. So record your numbers, medications, recent visits, kind of keeping a catalog of information, if you will. You know, we do it all the time at work. I have a running OneNote tab for everything. I don't do that with my health, and I probably should. So keeping information for yourself that you will always have access to, it helps you see those trends over time. It helps you come to appointments prepared to speak about something, just like you would prepare notes to go to a meeting. It's just translating all those skills that you probably already have to your health. And I wanted to quickly mention this one because it is a little bit more relevant for some of the changes we had at the county. Whenever we transitioned from Cigna to UMR and a lot of the Quest accounts got wiped, people lost previous results. And if they didn't have a physician that recorded that information, your last year's blood work is gone. You can't access it unless you took record of it on your own and kept it somewhere on your own. The information's gone. So you won't be able to see those trends in time. So being prepared and having something for yourself, not relying on a portal, because what if you switch doctors, or what if your doctor goes out of network? Having something that you can hold on to and that you are solely responsible with is a little bit more safe, if you will, because then you're not subject to, again, doctor changes, portal changes, vendor changes, all of these external factors that you have no control over. So again, a notes app, granted your phone could crash or something, so maybe a good old pen and paper, it feels more comfortable for you. But being in control of your health information and taking ownership of that, be like, oh no, my doctor has it, they'll track it, whatever. Have control and ownership over that information. It is your information after all. Setting reminders for preventive appointments. So scheduling routine checkups, screenings. Like I said, you know, if you're around that age for a colonoscopy, or if you know you have to get your pap smear in a year or so, set reminders for them. Don't trust yourself just to remember. I don't know about you and how your guys' memory is sometimes, but I know I forget things all the time when I could have just had them in my brain. So allowing yourself to just take a quick second, you know, put something into your phone. If you have a pocketbook, we love a little pocketbook calendar. If you have a little pocketbook, write something in there. You know, oftentimes a provider's office will send you away with like a little appointment card that you may stick on your magnetic calendar near your fridge. But instead of relying on that, set a reminder for yourself, like I said, in your phone or somewhere that is a little bit more permanent than this tiny little appointment reminder card. Last few here, ask your provider to explain in plain language. If something isn't clear, like test results, medication instructions, diagnoses, speak up. Don't feel pressured to understand everything on your own. Your provider is there to help you. Presumably, they have gone through a lot of schooling to get where they are. There are a lot of big fancy words for a lot of things out there. And there is a responsibility on us to understand kind of what's going on with our health. But if that information is not being presented in a way that we can understand, there's this barrier. It's not necessarily a language barrier, kind of, with kind of medical jargon and then plain language. So if something is said to you, like if a doctor, it just says you have hyperlipidemia, and you're like, I don't know what that means. They could say high cholesterol and then go into what that means, because you may not equate those two terms together. You may now that we just went over them, but you may not piece those together, because why would you? You're not a doctor, and that's okay. So if there is something that you do not understand, or they throw out a term that sounds like something you've never heard of before, absolutely speak up. You paid for that doctor's appointment. Get the information that you need to feel confident about your health and where your health is at. I do want to quickly mention this last little point here. Just because we live in such a digital day and age, double check what you see on social media with credible sources. Not all online health advice is trustworthy, and I think we know that. But before you decide that you are going to try a new diet plan or some type of fast or a supplement or something that you may think about, you're like, I may have some doubts about this one. Consult a professional, whether that's a physician or somebody in your care team. Ask them questions. Be like, hey, I came across this. Here's the information that it came with. Here's why I think it could be a good idea for me. What are your thoughts? What do you think about this for me and my health and where I'm at? Because that's going to be so different for everybody. So a lot of information online is made for kind of clickbait. You know, people want you to click on things, and it may not always be super honest. So always consult a professional, consult your care team, have those conversations if you're truly interested in something. Okay, we're going to go over a couple of resources, and the next couple of slides are kind of photos of these resources so you guys can familiarize yourself with them. But I did want to quickly mention Generation U. I'm going to call it Gen U because that's a little bit longer of a name, but Gen U, it is an employee advocacy service available to employees and their dependents on the medical plan to help navigate medical care needs. So whenever you first call in to Gen U, you speak with a Gen U guide. They may refer you to a registered nurse and or a social worker to assist with certain situations. They themselves may be able to help you directly, or they can refer. This is a really good service, whether you're working through new or even old diagnoses and you need some guidance and assistance, you have some questions, but you're not really sure where to start. Maybe you don't have a developed care team. Maybe you don't have a team of professionals around you that you know exactly who to go to whenever you have a question. This is a really great service to call into and be like, hey, this is what's going on. I don't really know where to start with this. I don't know what resources are available to me. I don't know what I need. This service is designed to help you find those services that you need. This is an advocacy service for our employees and their dependents. Speaking of making informed choices with your health, annual enrollment is right around the corner at the beginning of November, and the benefits team has 3 upcoming webinars to provide updates where you can ask questions. I'll show the little photos later, but it's on October 30th, so just a few days from now, tomorrow, I think, November 5th and November 6th. If you prefer a more private setting for questions, because they do have some Q&As in those sessions, but if you prefer a more private setting, there is a benefits booking link in the HR A to Z guide that you can make in person or virtual appointments with. So if you're not sure where to start navigating your benefits, they are a wonderful resource, and the whole team has availability. Make an appointment, ask all the questions, whatever you have. Don't leave anything unanswered or anything just up to the wind. Ask questions. If you don't understand the differences between this plan and this plan, ask. They are more than happy to help you out. And I'm just going to take a quick look into the chat real quick, because I know I have some questions. Yes, advocating for yourself. That I want that to be the theme of today's webinar for sure. Should BMI and body fat percentage be close in numbers? Not usually. Body fat percentage, BMI is just based on height and weight. So it's not necessarily a body composition measure. When we say body composition, that is how your body is composed. So fat mass and fat-free mass, but BMI is not reflective of body composition. So somebody could weigh, they could be 6 foot, weigh 250 pounds. Let's just be crazy here. Maybe half of that is muscle, okay? But let's take the exact same person, 6 foot, 250. They have, like 2 pounds of muscle. Those people are going to have identical BMIs. So it is just more of a standardized number. If you are more interested in body fat percentage, Shannon, who's our on-site health coach, she has a Tanita scale that does body composition numbers and is able to do those kinds of readings. And those can be more helpful because it gives you a better understanding of the makeup of your body and the certain risks that come along with having a higher fat mass. I think they are, Valerie, I do think they are recording the sessions, and it looks like we are not recording them on our YouTube channel, but let me get with my benefits team and maybe I can send you an email, Valerie, with some of the recordings. I believe they are recording them. I believe so. I heard one of the recordings go off yesterday in their session yesterday. But yeah, let me get with my benefits team and I can probably shoot you an email later with some of the recordings. All right, so we love our benefits people. They're fantastic. In addition to them in their education, the wellness team, such as Shannon, who I just mentioned, our on-site UMR health coach, Lorelei, who is our on-site EAP counselor, and myself, we do webinars on a variety of topics for education about health and wellness and the whole picture. And Shannon actually has an upcoming webinar for diabetes on November 3rd. So that's just kind of a quick example of some of those webinars that we do. And then Medline Plus and CDC, some online resources that you can visit to find healthcare information. Medline Plus, I have a screenshot of it a little bit later down. It has multiple health topic lists, including medical tests, drugs, supplements, and general health topics. And the CDC has an A to Z guide index where you can search most health topics. These resources are a really good place to start when trying to understand a new condition or medication, but ultimately, please do reach out to your physicians if you need any further clarification or if you have more questions. So this is what the GenU looks like and how you can access it. You can access it straight from the UMR portal. You can call in by phone, UMR Health app. You can also visit the HR A to Z guide under G for GenU. It's right there. All the information. I literally took this screen grab from that webpage. All the information is there. This is what Medline Plus looks like over on the right-hand side. Again, tons of like different little categories that you can click into. They even have a recipes section, but again, just a good place to start if something is said and maybe you think about it after the fact and you get home and you're like, what the heck were they talking about? This is a good place to just quickly reference. But again, if you do have further questions that need more clarification, reach out to your physician. And then CDC, Center for Disease Control and Prevention, a little screen grab I took from their webpage. They have a health topics bar at the top of their webpage that'll show that A to Z guide. This is the website for the annual enrollment information sessions. If you use that HR A to Z guide under A for annual enrollment, you'll be able to navigate to these. So October 30th, November 5th, November 6th. And like I said, I do believe they are recording them, and I will follow up with that email whenever we're done. And then just a quick visit to our wellness classes page. This is where we have all of our webinars, all of our activities, on-site, virtual, whatever it may be. A lot of our screenings pop up here. Great, again, great resource for you guys to visit. Hopefully you've seen it before. And there is just that quick mention of Shannon's diabetes webinar that is upcoming.